For those Americans living in rural communities and even small towns, a visit to the doctor can turn into a full day's trip. To lessen that burden, in recent years, some physicians began to see their patients online. The practice is known as telehealth, and in the age of the coronavirus pandemic, it has suddenly become more important than ever. NewsHour Weekend's Maury Rothman has our story. It's part of our ongoing series, Chasing the Dream: Poverty and Opportunity in America.
Mississippi has a lot of small towns, and Lena might be the smallest, with a population of less than 200. But that's the perfect size for 73-year-old Esther Denson.
It's a big difference, I guess, but I love the country. I just love being out here.
Like many rural areas, Lena has no hospital.
That's the only drawback of living in the country. You're not near a facility, and if you have a heart attack or something, you might die.
Denson has type 2 diabetes. When she needs to visit the doctor, it's an hour's trip each way. She used to have to make that trip every 3 months, but not anymore.
These are the strips I use right here.
Now she uses a tablet to check her blood sugar 3 times a day. She's part of a trial run by the University of Mississippi Medical Center.
It's testing. Ooh, I'm up slightly. I'm usually 114, 1 something, but I'm up to 137.
Denson's nurse Cindy Broom keeps track of Denson's blood glucose from her office 40 miles away and checks in with her if she spots a problem.
Her numbers come to us. We're able to review it on our dashboard, but we're really looking for a pattern of, is she coming down, is she going up, or is it up and down, up and down? Yesterday's blood sugar, 104.
Because of the trial, Denson sees the doctor half as often as she did before. It's part of a larger effort to increase care for rural patients in Mississippi, where access to health care is a major problem.
Mississippi is a state that has a lot of healthcare issues. We're ranked at the top of all the bad lists and at the bottom of most of the good lists.
Michael Adcock led what's known as telehealth at the University of Mississippi Medical Center in Jackson for the past 4 years.
We have a very high incidence of chronic disease burden, and we have the lowest or the next to lowest number of providers per capita in the United States. So we don't have enough providers, and we have a very sick population in most cases. So it's a bleak picture in a lot of ways, but that's also what helped push us into telehealth. So this is our electronic ICU. Okay. So we're monitoring patients in the intensive care setting.
The medical center began offering telehealth services to faraway patients in 2003 because in Mississippi, a good number of patients are far away.
When I think of, if I'm sick or if I have an emergency, I live in New York, I go to the nearest hospital.
Right.
How is that different here in Mississippi for folks if they're not right in Jackson?
Sure. So Mississippi has one level 1 trauma center. It's in Jackson. We have one children's hospital. It's in Jackson. We have one school of medicine. It's in Jackson. So all of these things are located in Jackson. There's some great medical centers, but they're all in the populated areas. And a very large percentage of the population lives outside of those populated areas. So it creates a barrier to care. When you have poverty and you have rurality, it makes it sometimes difficult to be able to even get to the provider's office, much less go to the hospital that may be an hour and a half or 2.5 hours away. It might as well be in another state or another country.
Many of our patients don't even have their own transportation, so they may have to rely on a neighbor or a cousin or a friend to bring them to their appointments.
Shannon Friery is the director of telehealth at North Mississippi Medical Center in Tupelo, Mississippi. It's the largest rural hospital in the U.S. Friery also works as a nurse practitioner. She says telemedicine has made it easier for her to care for her patients.
Well, hey, Miss Betty, how are you doing today?
Just fine, thank you.
Good.
Her patient Betty Holloway uses telehealth to receive care for a bone infection. Friery can remotely discuss medication, view lab work, and using a stethoscope and camera connected to the internet, not only listen to Holloway's heartbeat,
Sounds really good. Okay.
but also inspect any wounds her patient may
You
have.
still got a little scab there, don't you? You don't think about it, but when you're in pain, it's not easy for you to sit or stand. Getting in and out of your house to a car, to get in and out, to come into a clinic.
Specialists like mental health practitioners are a rarity in remote areas.
We are one of the lowest ranked states in services available. There is about, depending on what year you look at, it's about 4 to 6 psychiatrists per 100,000 people. That's in contrast with, for example, Washington, D.C., which has about 24. So we're at the very bottom. Over the time that we have been talking and knowing each other, how do you think...
Dr. Demetrio Prota is based in Tupelo, but can reach his patients wherever they are through telepsychiatry. Prota says patients show up to more appointments when given the option of telepsychiatry. In a conversation this week, Shannon Friery said because of the COVID-19 pandemic, telehealth has been thrust into the medical spotlight.
We do need to be cautious at times, but I think this virus has really thrown telehealth in the forefront and has really helped some providers who had some concerns about, is this really a good way to offer patient care, where they certainly see the value.
Mississippi doctors aren't alone in adjusting to the COVID-19 pandemic. Before the pandemic, there were few states that allowed patients to see a doctor from their home via telehealth. But now, most have waived those restrictions. That makes sense to Friery.
Now that we're trying to limit patients, especially those vulnerable patients, so non-essential visits, we don't want those patients to come into our clinic and risk exposure, not necessarily in our offices, but just getting out and about, getting in town, stopping to get gas, doing other things that they might be tempted to do. We really, really, really need people to stay at home. And so we are now able to do a virtual visit into their homes using some of those platforms that are available.
But telehealth is not a panacea. In Mississippi, as with many states with large rural populations, a major obstacle to its expansion is lack of high-speed internet access. Shannon Friery says that the connectivity gap is especially glaring now that the pandemic has increased the number of telehealth visits.
Not all of our patients have fancy-dancy iPhones or Androids and have that connectivity. So there certainly is some restrictions, and that's where broadband and the push to move that forward is just so critical, especially in a rural state like Mississippi.
But she says she's hopeful that the connectivity challenges can be overcome, and that the surge in telehealth will remain long after the coronavirus crisis is over.
I feel like having this unfortunate outbreak has really opened up the guidelines to be able to help us to deliver better care, more timely, more effective. My hope and my prayer really is that once this crisis is over, that the guidelines will stay relaxed, or that we can at least go back and reevaluate kind of where we are, what worked well, and leave things open so that we can continue to use and refine this very, very valuable and critical tool to patient care.